Willie D Live.
So
I prepare everything, and I look myself in the mirror, and I do it myself.
do you sell kits so somebody can take it to the house? Or do they have to?
Not really.
Yeah,
It's
not a good idea.
It's a little bit more to do with it because you have to make sure it's temperature regulated. You have to reconstitute in a certain way. When it comes, the bottle comes with just the powder inside, and that's the active ingredient. But then you have to reconstitute it, which means that you mix it up with some injectable, saline, so that you can actually inject it. And everyone has their different amounts that you mix it with, right? Their different formula, so that then you can inject it wherever you want to, whatever area you want to treat. And then once it gets reconstituted, once you mix it, you have 1 to 2 weeks to use it. Otherwise, it goes bad or it starts losing its effective. And it's not really like you're going to get anything bad happen to you. It just means that it's not going to work as well the longer from the time that you mix it.
And how long does it last once you use it?
Once you use it, 3-4 months.
3-4 months?
Mm-hmm.
You see any wrinkles up here?
Yeah.
3 months.
These wrinkles, these right here, when you smile, you get the crow's feet is what they call it.
Yeah.
Here they're called these ones the 11s, where you do like that, and then you have those lines right there.
This is right up in here is how I can usually tell how old somebody is.
Mm-hmm.
Typically, some people have very good genetics where they can be a lot older, but they appear to be a lot younger.
Right.
But I look around up in here, this tells.
That's a good tell. Mm-hmm.
Yeah, because I remember my niece was dating this older dude, and he told her that he was in his 20s.
Mm-hmm.
And if you just look at him, just do an overview of it, say, yeah, he looked like he could pass for 20s.
Mm-hmm.
But I saw those little wrinkles right there, and I said, now, dude got to be late 30s or 40s, right?
Yeah.
So I pulled him to the side, and I said, say, man, whatever you got going on with my niece, that's between y'all. But I need to know who you really are. Between me and you.
Right.
How old are you, bro? He looked at me. I said, now, how old are you? He was like, I'm 43. I said, all right.
There you go.
That's all I want to know, man, because I don't try to tell people,
exactly
who today. I don't care about that kind of stuff, but I just need to know who you are.
Keep it honest, be real.
I just need to know who you are.
Absolutely.
How do you know if you're a good candidate for plastic surgery?
That's a very hard question to answer. Yeah. Just because plastic surgery has so many, it's so varied, so a large amount of surgeries that you perform. It all depends on what your goals are, and that's basically a lot of what I do, a lot of my jobs, right? Where patients come to me, and the first question I ask is, what can I do for you, right? What are your goals? And managing those expectations, because you might come, expecting X, but that's not really realistic for you, right? So it falls on me to manage those things, right?
Yeah.
So it's a very hard question to ask. So as far as a good candidate, leave that up to me, right? What are your wishes? What are your concerns? And I'll tell you, okay, we can improve that with A, B, or C. I can give you a couple of options. This is the best one. This is, middle of the road, things like that, for the most part. A lot of them I can be like, no, this is what you need.
Yeah. A person got to really trust you, man, to, allow you to mess with their face, I get a tummy tuck and stuff like that. Okay, we can hide that kind of stuff. But you blowing up in my face, man, people got to really trust you.
Absolutely.
Have you ever had a situation where the results didn't come out like a client wanted and they got really hot at you about it?
Actually, no.
No?
I've had, anyone that tells you that they haven't had any sort of conversations about results or complications or things like that, they're lying to you, right? But as far as someone coming to me like that really, really mad because the result was bad, that I can honestly say that that's never happened to me.
Yeah.
Has it happened where they're like, oh, actually I wanted a little bit more right over here, these little things? Yes, that can happen. And when they do happen, it's a conversation. It's about if it's something that I should have done better, then I fix it right then and there. Right? If it's something that is about managing expectations, then we have to like have a conversation like, hey, that's not what this treatment usually does. This is what it usually does. And that's why I haven't had almost any like that, because I spend a lot of time managing those expectations, teaching. A lot of what I do is teach and letting them know this is how it's going to end up. The more time you spend before you do any sort of treatment, even things as simple as Botox, where people think that that's just, whoever. No, you have to know where to inject, right? You have to know how everything is going to look afterwards. You should be seeing before and after pictures, right? That's true with Botox fillers or things as big as, breast lifts or tummy tucks or even BBLs, right? Showing that before and after and really listening to what are you expecting afterwards. Showing me pictures of this is how I want to look. And then I can be like, okay, that's attainable, or you can't go from having no butt to having, Kim Kardashian butt.
Right.
Right? It's about, then the more time you spend doing that, then the less things like you just described of people being mad of like, oh, it's looking this way, the less that happens.